think we're good. Looks like we have everyone dialed in. We've got about 940 veterans on the call, so thank you for joining us, and welcome to the Madison VA Hospital's live Teletown Hall. My name is Jim Bove. I am Public Affairs Chief at the hospital, and I'll be moderating this afternoon's call. We have a panel of Madison VA's leadership team here to answer questions and to provide program updates. Today, we'll share information about several resources and services, so I highly suggest you have a pen and paper close by so you can write them down. We'll provide information about caregiver support, traffic and construction updates, expanded use of our behavioral health lab touch platform, how and when community care works, and upcoming events including our Purple Heart Hall of Honor, our VA Night at the Duck Pond for a Madison Mallards game, and our Women's Veterans Day event. We hope you stay on the line with us, and we encourage you to participate in the question and answer session. To ask a question, just press 0 on your phone at any point during the call, and you'll be connected with our staff who will take your question and get you into the queue to speak with our panel during the Q&A session. We usually don't get to all of your questions, but you'll have an opportunity to leave us a voicemail at the end of the call so that we can follow up with you. If you get disconnected from the call, unfortunately, there is no way to rejoin, so please stay on the line. We'll also post this on our website within the next week or two if you want to go back and listen. As always, we like to start our calls with a message from our hospital executive director, Christine Kleckberger. Welcome, Christine.
Thank you, Jim. I hope everyone joining us is having a good spring and enjoying the warmer weather. We've got a lot of events planned now that the weather has improved, but first I want to address the question many of you have to the best of my ability, and that's how or if your health care may change with an impending reorganization planned. As I mentioned in our last town hall, there has been a lot of information shared from our national VA office regarding a reduction in force and reorganization plan. It is required that VA publishes this plan at some point in June. Though we are aware of challenges in court which could cause delays to the timeline, we are not aware of how or if the submitted plan by our national office will affect us locally. As I've mentioned before, it's important for us not to speculate on hypothetical or potential scenarios involving future VA changes. Caring for veterans is the highest honor, privilege, and sacred duty, and we strive every day to deliver the finest possible care to our nation's heroes. We don't have answers to all the questions you may have right now, but VA is assessing staffing levels across the entire department with the goal of implementing a reduction in force that could affect as much as 15% of VA's workforce, or about 70,000 people. Secretary Cullen stated this will be accomplished without making cuts to health care or benefits to veterans and VA beneficiaries. At the Madison VA Hospital and Clinics, we will do everything in our power to minimize any local impact. In fact, we have been working over the last year to review and assess staffing to ensure we are adequately resourced to meet the current healthcare needs of the veterans we serve. We have been successful in reducing and reallocating positions and other resources, and see the Secretary's goal for further staffing reduction as an opportunity to continue our efforts in resource management and fiscal stewardship. I don't know how or if this national plan will impact us locally, but I understand this may cause anxiety for those receiving care here. We strive to ensure that any changes made will not negatively impact the care you receive from VA. Now, changing gears, we are honored to induct Private First Class Dennis Stoppelworth into our Hall of Heroes just before Memorial Day. He was killed while serving in Vietnam, but he sent over 70 letters and cassette recordings home during the few months he was over there, never once hinting that he was ever in danger. It was only after he lost his life that his family learned that he'd been awarded a Bronze Star for his heroism, and he posthumously earned a second Bronze Star. Thanks to his family and friends for nominating him, and thank you to everyone who attended and made it a special day for his family. Next, we have a few dates and events coming up this summer that you'll hear about shortly, including our Women's Veterans Day celebration on Thursday, June 12th from 4 to 6 at Lakeview Memorial Park in Middleton. Wisconsin is one of 14 states that recognizes this day to honor the contributions women veterans have brought to our military and country. Again, we'll have more details on that event shortly, but I encourage all of you to stop by next Thursday, June 12th. Also, our Purple Heart Hall of Honor, which we began last year to honor veterans wounded in combat. Each year, we'll plan to induct a class of about 5 inductees whose names will be displayed on a plaque at the hospital on our Hall of Honor that is located on the first floor of the Bluffs Clinic. I encourage you to nominate a veteran you feel is worthy of this distinction. The deadline for nominations this year is June 16th, and we'll have more details later in this call for you. Thank you all so much for your service, and I look forward to seeing you at some of our upcoming events.
Thanks, Christine. As you mentioned, there are a lot of great resources and events available to veterans, families, and caregivers. And speaking of caregivers, I'm going to turn it over to Jenny Pinton-Mackey for an update on an upcoming event for our caregivers.
Thanks, Jim. The Madison VA Caregiver Support Program is proud to offer the Caregiver and Family Resource Fair to fulfill the mission to care for those who care for veterans. It's on Friday, June 27th from 11 a.m. to 3 p.m. at the hospital, and we encourage all of you to stop by. The Caregiver Support Program provides support and services for caregivers of veterans with focus on improving their quality of life through education, resources, support, and services. Each year, the Resource Fair brings together VA and community resources while allowing you the opportunity to meet other veteran caregivers. This year, we are so excited to welcome many community members with a wealth of resources available to caregivers and families of our veterans, such as VA and Dane County Dementia Care Specialists, representatives from the local National Alliance on Mental Illness, the Community Alternative Response Emergency Services, or CARES team, the Madison Police Department Mental Health Unit, representatives from the VA Medical Foster Home, and tons of resources from Veteran-Directed Care, VA GeroFit, Falls Prevention, Suicide Prevention, Women's Health, Peer Support, and VA Benefits. That date again for the Resource Fair is Friday, June 27th from 11 a.m. to 3 p.m. We will be set up outside in front of the main entrance. If it rains, you'll find us just inside the main entrance by the auditorium. There is no need to RSVP to this event. Just show up ready to connect and hopefully learn something new. If you or your caregiver has questions about all that the VA Caregiver Support Program has to offer, please reach out to us at 608-256-1901, extension 11576. Again, that number is 608-256-1901, extension 11576. We look forward to hearing from you and meeting some of you in a few short weeks.
Thanks, Jenny, and thank you to those of you helping to care for our veterans. If you're a caregiver, we hope to see you June 27th, so be sure to share it with your friends and family. Share that information. Next, we're going to talk traffic patterns and construction projects that may affect your next visit to the hospital with our Hospital Associate Director, Abe Rabinovitz.
Good afternoon, everybody. If you visited our hospital over the last few weeks, you probably noticed that the Madison Metropolitan Sewerage District began replacing critical wastewater infrastructure near our hospital, impacting Highland Avenue access. The project began just after the University of Wisconsin's graduation and will run through approximately September 5th of this year. Of course, there are many factors that may bump this expected completion date. Access to the hospital main entrance and parking ramp from Highland Avenue north remains open. Detour routes and a map can be found on the Madison VA website. For details on the larger project, visit the city's Highland Avenue Sewer Project page at madsewer.org/Highland. Again, the city's project site is madsewer, madsewer.org/Highland. We anticipate there being traffic delays trying to get in and out of the hospital due to this project, and so far they have been minimal. But that may change as the construction project progresses, so please add a little time in getting in and out of the hospital when you're visiting. We appreciate your patience during the process, and I'm sure the city does too. We also would like to report that we're undergoing construction in our back parking lot by our emergency department and cancer center. You'll notice that a few ground-level employee parking spots have been blocked off, but there are still spots specifically for those visiting our emergency department and our cancer center. So if you're headed to either the emergency department or cancer center, there are parking spots for your use only. All other visitors will need to enter as normal by the main entrance parking garage. Thank you all for your patience through construction season. Back to you, Jim.
Thanks, Ed. We're going back to some upcoming dates and events that you might be interested in. And to hear more, we're going to turn it over to our Chief of Community Relations, Joe Naylor.
Thank you, Jim. As Christine mentioned in the opening, we're currently accepting nominations for our new Purple Heart Hall of Honor, which we started last year with our inaugural induction in August. The Purple Heart Hall of Honor recognizes the selfless sacrifices by veterans who are currently or would have been eligible for care here at the Madison VA Hospital and Clinics. Our next induction will take place this year on National Purple Heart Day, which is Thursday, August 7th. Approximately 5 inductees will be selected each year, and they'll be honored on a plaque on the Purple Heart Hall of Honor wall at the Madison VA Hospital just outside our outpatient lab. Criteria to be considered is that the veteran must have served in a conflict or wartime, been wounded or killed due to enemy actions, and he or she must currently or would have been eligible for care here at the Madison VA Hospital or any of our clinics, and demonstrated a connection to the local VA and community. All of this information and application can be found on our Madison VA Hospital website and by searching for the Madison VA Purple Heart Hall of Honor. For a veteran to be considered for this year's induction class, we'll need to receive the application no later than June 16, 2025. Also, our annual VA Night at the Duck Pond with the Madison Mallards baseball team is Friday, July 25th. This will be the 4th year for this event. Veterans can receive a discounted game ticket, and we'll have a VA and community resources there for you to learn about, so make your plans to please join us. Ticket information will be available soon. If you subscribe to our newsletters or follow us on Facebook, be on the lookout for information. First pitch is scheduled for 6:35 p.m., but we'll be there much earlier than that with our community partners. Again, that date is Friday, July 25th. We hope to see you at the ballpark. Thank you.
Thanks, Joe. Next up, we're going to learn how primary care has been using the Behavioral Health Lab to communicate with patients. Here to tell us more is our Deputy Chief of Primary Care, Erin Mullen.
That's right, Jim. Some of you may already be using it, but Behavioral Health Lab Touch, or BHL Touch, is a secure online tool that our mental health department has been using for quite some time. Some of you may have seen a recent message about this in My Healthy Vet as we're trying to expand the use of this program. BHL Touch allows your care team to send you a variety of questionnaires before an appointment to better understand your current mental health needs, identify additional services that may benefit you, and help us to make more informed decisions about your diagnoses and treatment options. If your team uses BHL Touch, you'll receive either a text or email from the VA stating your VA provider would like to know how you're doing, along with a link to click. You simply complete the questions from your device, a smartphone, computer, or tablet, and look for a completion message. The responses are automatically forwarded to your care team for review. Based on your responses, you may receive a call prior to your appointment, or your provider may discuss it with you at the time of your visit. Some of these questionnaires can be quite lengthy. Completing them in advance of your appointment allows your care team to be more prepared for your visit, and it allows extra time to talk during your visit, instead of spending that time completing the forms.
Thanks, Erin. Be on the lookout for a message from BHL Touch. It is definitely not spam. So be sure to look for it and respond. Switching gears, we get a lot of questions about community care. What is it? How does it work? Here to explain is our Chief of Community Care, Melissa Conover.
Thanks. As the nation's largest integrated health care system, VA is well prepared to serve you with the high-quality services you deserve. As you are likely aware, VA also partners with community providers to offer care options outside the VA system at VA's expense through a program called Community Care. Community care is based on eligibility requirements, availability of VA care, and veteran-specific needs. When you're considering healthcare options, whether with the VA or in the community, we are committed to helping veterans make informed decisions that support their health goals. Here are a few questions to ask. What is the wait time to see a provider? Are additional specialties available at the same location? Do providers have timely access to all your medical records? Are telehealth services available? Does the provider have a strong quality rating? Does the provider specialize in veteran-related illnesses, injuries, and chronic conditions? Do your providers collaborate to support your treatment plans? We are proud to offer you care with the whole health of the veteran in mind. With most specialty services available in-house, our teams work closely to help you achieve your best health outcomes. We hope you'll continue to choose the VA for your needs, but should you also use community care, our staff are committed to supporting the best possible experience. For more information about VA healthcare services and community care eligibility, talk with your VA provider or visit www.va.gov/communitycare. Again, that website is www.va.gov/communitycare.
Thanks, Melissa. Hopefully that information will help those of you weighing any healthcare options in the future. We've got one more event to tell you about, and that's our Women Veterans Recognition Day event happening next week. And here to tell us more is Lindsay Mueller.
Women Veterans Recognition Day is not a separate Veterans Day for women. The day recognizes, honors, and remembers the signing of the Women's Armed Services Integration Act on June 12, 1948. Allowing women the right to permanently serve in the regular armed forces. There is so much history about women veterans to be told, and it's important that women continue to be recognized for their service and sacrifice. Women have served in America's wars and conflicts throughout our history. Today, women serve in all military occupational specialties. When they leave active duty, they should feel like they belong at the VA. Please join us on June 12, 2025, from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin, as we recognize and celebrate women's unique contributions to the freedom of our country. We will have 3 women veteran speakers, a picnic-style dinner, live music, and informational booths. Join us and our partners from the Wisconsin Department of Veteran Affairs, American Legion Post 360, and VFW Post 8216. Again, that is on June 12th from 4 to 6 p.m. at Lakeview Memorial Park in Middleton, Wisconsin. We hope to see you there.
Thanks, Lindsay. Please stop by and say hi. All of you are welcome. Again, that's June 12th, 1 week from today, from 4 to 6 p.m., and the weather looks beautiful at Lakeview Memorial Park. One last reminder before we get to the question and answers. As you've heard for several months now, there was a new sign-in change for your My Healthy Vet account, which has already taken place. If you haven't made the necessary changes, then you likely won't be able to access your My Healthy Vet account now. You can no longer use your My Healthy Vet user ID and password to sign in. Now there are 2 sign-in options, and that's either by using ID.me or by using login.gov. If you already created an ID.me or a login.gov account, that's great. You should have normal access to your My Healthy Vet account. If you haven't created an ID.me or login.gov account yet, we encourage you to do so immediately. If you're not sure if you have already done this, try logging into your account, your My Healthy Vet account or VA.gov account, and you'll be greeted by a sign-in option or a prompt to create an account if you haven't done so yet. And that will take you to either the ID.me or login.gov websites. As always, It's your choice whether you want to get a My Healthy Vet account. Your choice won't affect your eligibility for VA benefits or your health care in any way. However, if you choose not to get a login.gov or ID.me account, before this change, you won't be able to access your VA information or manage your benefits and health care online. You can always manage your VA benefits and health care by phone, by mail, or in person if you choose. For more information about these changes and step-by-step instructions, visit the following website, www.va.gov/sign-in-changes. That website has instructions and videos to help you through the process. The website again is va.gov/sign-in-changes. Or you can search online for VA sign-in changes and you should be able to see it. We understand that this process may be frustrating, so if you need help, please call 877-327-0022. Again, that number is 877-327-0022. Now it's time to move into question and answer portion of our call. We have several questions in our queue, and we'll call your name when we are ready for your question. We can see your questions on our screen, but we will ask you to repeat it so others can hear it, and then we will respond. Please avoid disclosing personal health information. We want to make sure we protect all our veterans' privacy as we answer your questions. So our first caller on the line is Bruce in Princeton. Bruce, go ahead with your question.
My question is, I was recently hospitalized at Aurora Medical Center in Oshkosh and later transferred to St. Luke's for two surgeries. Is the VA going to pick up any of that surgery and transportation and such? Seeing they're my primary care deal, but I had no time. This was kind of an emergency, or not kind of, an emergency.
Hi, this is Melissa with Community Care. The VA does cover eligible veterans for ED visits. There is a 72-hour number that veterans should call to report that they were in the ED. That phone number is 844-724-7842. That number again is 844-724-7842. You call that number and give them, they'll ask you the questions about what ED you were in and what's going on, and it has to be done within the 72 hours, and then that's how the VA gets notified for that claim.
What are you talking, 72 hours? This was already 8 weeks ago.
Bruce, I'm sorry, yeah, I was trying to remember, Bruce. If you want to leave your name after the call on the voicemail, we can reach out and see what options there are and how to get the best options and taken care of for you.
Okay.
All right, thanks, Bruce.
Yep.
Our next caller is Dindin in Baraboo. Dindin, go ahead with your question.
Hello.
Dindin? Hi.
This is Dim.
Go ahead with your question, sir.
I think I mentioned to you before I'm suffering from sleep apnea, and I wonder if I could get the machine that help you sleep through the VA.
Hi, Dim. This is Erin Mullen from Primary Care. We can absolutely help you with getting your CPAP device. If you had the sleep study through the VA, you would just need to reach out to your primary care team and ask for them to enter a consult for that machine. If you didn't have your sleep study through the VA, you would still contact your primary care team, and they can assist you in getting those local records, which we would need to submit the request for the machine. You can also get replacement masks and all the tubing and everything through the VA as needed.
Okay, thank you.
Thank you for your question. Our next question is Walter. Walter, you have a question about your annual visits. Go ahead.
Good afternoon. Thank you for taking my question. In the past, I typically have been asked to come in for an annual physical, and generally they were quite thorough with that. And my last one, which is now going to be going on 2 years, I understand that the annuals are no longer in effect. However, at this last event, it was pretty much a blood pressure test and heart rate and a few questions about my health, and that was the extent of it. So I guess my question is, why did that change? And is there any possibility of having a complete physical done at a VA clinic? Thank you.
Hi, Walter. This is Erin Mullen from Primary Care. So no, the standards haven't changed. I think depending on what you're coming in for and the different health issues that you talk with your primary care provider about, that kind of leads the course of what type of physical exam that they do for you. So I think if you would like more of a hands-on physical, you absolutely can have that. And I would just express to your care team kind of what your expectations are for that visit and for the type of exam that you'd like to have. We also sometimes patients have a lot of care through specialty or outside the VA that they don't necessarily have to come every year, but if that's something that you're requesting, we can also absolutely accommodate that to come in annually for a physical exam.
Okay, thank you. I will go ahead with that. Thank you very much.
Yep.
Thank you, and that's a good question. In fact, one of our screeners just messaged us. There was a second person in the queue to ask that same exact question, so we appreciate that. Our next question is coming from Edward in Montello. Edward, go ahead with your question.
Yeah, hello.
Hello.
Yeah, my question, I guess, is about the community care issue that seems to be just ever growing with I just switched from Toma because it's just a horrible facility. And I had appointments through community care that took months to even organize and get approved. And now since I'm in Madison, those appointments are being canceled, and basically my health care is being prolonged just for the simple fact of bringing me into the Madison facility to do an EMG when we'll schedule it for you, Mr. Smith, but it's going to be 6 weeks from today versus the community care's out in the community, and I can get that done next week if I wanted. So why is the VA prolonging veterans' health care intentionally? Like my new primary care doctor's like, we need to get you some blood work done and your annual physical, what the other guy just talked about, what they're just going to take blood basically. And, but they can't see me for another 6 weeks. My quality of life right now is I sit or lay on my floor and I need care. And the doctors keep telling me they care and my mobility's gone, but nobody can see me for 6 weeks to 2 months.
Hey, this is Dr. Marsh. I'm the Chief of Staff here. So I am so sorry this is happening for you right now. We absolutely can do better, and we can get you in sooner if you need to be seen. So this will be the second. This will be the. I saw some. They sent me to the Gold Team initially, and I'm 48 years old. I got switched to Baraboo, which prolonged the issue even further. Like I have lower spine issues. They removed my pain meds after 20-some years of being on pain meds, and all they're willing to push is some drug called buprenorphine, which doesn't work. So currently, I'm only being prescribed muscle relaxers.
Totally understand how frustrating that can be. So why don't we do this? Let's have you leave your name
and your contact information at the end, and we will follow up with you on this, okay?
Right, but my issue is I expressed this to the last two doctors I spoke with at the VA in Madison, and they don't seem too bothered by it. I've expressed this to the patient advocate in Madison, and they don't seem too concerned other than relaying the messages to the doctors I'm seeing.
So we certainly have a process in place for the patient advocates to raise that.
And he's doing awesome. There's only one of them, and he does better than all four of them in Toma.
Okay, well, thanks for that feedback. And again, I think we need more specific information from you, and I think it's best served if we can get your specific names.
But I'd still like an answer as to why the VA is pulling community care appointments and bringing them back to the Toma to the main facility when there's faster, better solutions. They're still prolonging veteran health care.
So
that's my issue.
There is no expectation for that, so I think what we need is to see
what's going
on for you.
But that's what the community care's for, is to get veterans faster health care.
Sure, and we are not...
It shouldn't take 6 weeks to get an appointment scheduled.
Yeah, and we are not holding up any community care. We certainly have specific requirements, and we're going to continue to follow those. But really, I want to dive into what's going on in your particular case. So again, I just ask it if you could leave that information. We will definitely follow up, okay?
Excellent. Thank you. Our next question is from David in Baraboo. David from Baraboo, go ahead with your question.
Yeah, hi. Thank you for taking the question. And basically, back in 1959, while I was in the military, I did have a head injury, kind of a head drop on my head and damage, and it affected my neck and by my back. And so I've had chiropractic care and problems that went on for ever since then. And my one concern is that I don't know if there's any damage to the brain itself. And I hear so much from the Amen Clinic, who is the top clinics in the country that deal with brain injuries or damage or Alzheimer's, and come up with not only what, if there is any damage to the brain, be very, with scans very specific as to what's going on, and then come up with solutions, and most of the time health-oriented solutions to correct the problem and get it turned around. So my question is, let's say in Madison or that the VA hospital or the university hospital, whatever, I know you work with them sometimes too. If there is any departments that do both psychologically make the deal with what's happening in my life, let's say, as well as where they do brain scans and come up with specific analysis of whether there is an issue there or is not an issue and how we might deal with it.
Hi, David. This is Erin Mullen from Primary Care. I see it looks like you get your care at the Baraboo Seabox. You should absolutely reach out to your care team there, and they can order an MRI of your head and your neck, and then also get you set up with specialists based on the findings from that. Some of that is done straight here through the VA. We have an excellent TBI clinic, and we also have neuropsych testing and other services available. So your primary care team can drive most of that, the start of that care, and get you all of the specialty consults that you need.
Okay, and I had brought this up years ago, and nothing was ever really done about it. I don't know where to go, but I haven't talked to the person that's doing my primary at the VA Baraboo Clinic now about it, so I could bring it up, make a point in the next couple of weeks ago and talk to them about it and see what they might put together then, I guess. But they do, there are systems or people in the VA that do that type of work that deal with things that could be affected, that hurt in the brain, and to find out. Well, that's good news. Okay, well, I'll do that. I'll contact the Baraboo VA office and talk to the person and see what she can do to maybe line something up for me then. Thank you.
Thanks, David. Our next question is Wayne in Waterloo. Wayne in Waterloo, go ahead with your question.
Yeah, thanks for having my question. My question is, I'm 100% PNP, and I recently got that rating. Where do I take my wife to get the ID so that she can have VA approved health care also?
Hi,
Wayne. This is Judy with eligibility. So to get for here at the VA, we give veterans their big card here. That's just for veterans. For your wife, if she's not a veteran, that would be either like Champ VA or the Deers office. I don't have that number with me, so I will give you my direct number so that I can give you that information. 608-280-7038. Again, that number is 608-280-7038.
Thank you.
Thank you.
Thanks, Wayne. Next question, we're going back to Baraboo. James in Baraboo, you have a question. Go ahead, James.
Yes, I get all my prescriptions to the veterans, and I read online if it's possible maybe to get a refund on your Medicare Part B. Is there anything to that?
Hi, James. This is Stephanie. I'm the Chief of Social Work here at the Madison VA. I think there's a lot of information on daytime television and also on the internet about different things that are advantages or disadvantages to Medicare and different refunds that you can get on your premium for Medicare or lower premiums for Medicare. So what I typically recommend people do is to get a hold of social work and try to look at your specific situation so that we can give you what options you have, and then you can make a decision. We certainly can't tell you what to do, but there are some different plans that for-profit corporations offer, and it's just really, you have to be really careful what you end up signing up for and potentially signing away. And so I caution everyone on the call, if you are Medicare or Medicaid eligible, that you strongly consider talking with either the county or the social worker here to get some additional information before you make some what could be pretty consequential decisions if you unfortunately unsign yourself up for something. And so I'm going to give you the phone number for our main social work office. If you got a pen handy, it's
yes, I'm ready to copy.
Yeah, 608-280-7085.
Thank you.
Yep.
Thanks, James, for your question. Next question, we're going to Fox Lake, Wisconsin. Jeffrey from Fox Lake, go ahead with your question.
Thank you, sir. Appreciate it, and thanks for taking my call.
Sure.
My question is, as part of the reduction plans, if they come to light, will the Madison East clinics and or the Beaver Dam clinic be affected? Will either be closed down? Thanks.
Hey, Jeffrey, this is Aberman, as the Associate Director. Thank you for your question. As Director Kleckner mentioned in her opening remarks, we still don't have any direct information about the details of the reorganization plan. But as she also mentioned, Secretary Collins has made multiple public statements about it not having a negative impact on veterans' health care and benefits. At this time, we have no plans to close either East or Beaver Dam clinics or any of our clinics. Like you, we're waiting for final details on that plan, but we have no expectation that either of those clinics will be closed. And Christine's going to weigh in, too.
Yeah, this is Christine Kleckner. I'm the Executive Director. I just want to also mention that VA has actually opened up 10 new healthcare clinics across the nation since January 20th, 2025. Mm-hmm. And the Secretary likes to speak about that at events, so we feel confident.
Okay, well, thank you very much. I appreciate the information.
Thanks for your question, Jeffrey.
Next question, we're going to Janesville. Dale in Janesville, go ahead with your question.
Yes, ask a question about, I was going to get reevaluated on my disability. I'm in Vietnam veteran. And I did my tests and I got evaluated, but I also had a disability on my hearing, and I don't know if I got lost in the conversation, if I didn't fill out a form. I had nothing filled out. I just talked to the representative, and then I started going to these doctors and getting tests and all of that. And is there something that I should know that I have? This was already a disability I had, and I thought it was automatically going to go through, but apparently it didn't.
Hi, Dale. This is Erin Mullen from Primary Care. Can I clarify? You already are service-connected for your hearing loss, and you're wondering why someone here hasn't evaluated your hearing further? Or you had a compensation and pension exam, but they didn't give you a rating on your hearing loss?
On my electrocardiogram and that, it was all automatic. I was just sent to a Fort Atkinson hospital and had that done and everything, but I never heard anything back. On my original disability, I had a 10% hearing loss on that. It's not been checked, or is that just something that I should have filled out another form? Or?
Yeah, I would recommend that you go back to your county veteran service officer and check up on that.
Okay. But I was just that question because I already had these disabilities, and why the hearing was, I never did anything on that at all.
Yeah, this is Dr. March. So, usually if you want an increase for a currently service-connected condition, you have to specifically ask for it. So it sounds like maybe that was missed, and you need to talk about making that specific claim.
Oh, okay. Okay, well, thank you very much.
Thank you. Next question, we're going down the street in Wanakee. Rick in Wanakee, go ahead with your question.
Hi, good afternoon. I had a question about the new CDC guidelines on vaccinations. I had sent a My Healthy Vet message to my primary care team, and I got a message back that regurgitated some awful nonsense from the new CDC guidelines saying that I apparently was not a severe health risk, so I couldn't get an updated COVID booster. I am, in fact, I have coronary artery disease. I'm considered obese. I have sleep apnea and some other things going on, and I'm wondering what's going on with the new My Healthy Vet system that I'm now running into a call screener who apparently doesn't have access to my records, and they're just regurgitating some utter nonsense from the new CDC guidelines. Thank you.
Hi, Rick. This is Erin Mullen from Primary Care. So any sort of preventive health immunization, so COVID boosters, our flu shots, RSV, if you qualify for those immunizations, you can absolutely get those, including a COVID booster. We do like to follow the CDC guidelines, certainly. And my hope is that when you sent your message, your primary care team just didn't understand what you were asking, but we absolutely can get any of those immunizations at our CBOC locations as well as here at our main hospital.
Okay, I guess, yeah, I'm not sure why it's being run through a call screener or a message screener instead of going right to my primary doctor.
Well, Rick, if you want, you could leave your information at the end of the call and I can look into it for you. Most of our primary care teams actually have, there are multiple members on that team, and so it's not your provider that's the first view of all of those messages coming in because we get quite a few every day. So normally it's another member of the PAC team that's looking at those messages, and they are potentially not somebody who would be qualified to tell you whether or not you would qualify for an immunization. But everybody has those messages screened before they go to your provider.
Okay, thank you. I will stay on the line then.
Thanks, Rick. And as we said at the beginning, even if you're not in the queue, if you have a question or need something that we need to follow up on, feel free to leave a voicemail, and we will try to get back to you as quickly as we can. Our next caller is Richard in Middleton. Richard, go ahead with your question.
Hi, thank you. Richard Roberts, and I'm calling in regard to, I had a hearing disability when I left the service, but I never applied for benefits. And then when I did, they said my records were burned in Indianapolis, and I was wondering, is there any way to get the VA to reevaluate my hearing? I mean, I get hearing assistance from the VA, but is there any way to have this reevaluated since my records have apparently been caught up in a fire in Indianapolis?
This is Dr. Marsh. So the answer is yes, you can. So what you have to do is you have to usually talking to your county veteran service officer to help you with reopening that claim. And usually they give you some latitude if the records have been burned. And unfortunately that's happened with a lot of other veterans. And so they give you the benefit of the doubt with that. So absolutely talk with your CVSO and they can help you get that claim resubmitted.
Thank you for that. And now, one other thing. I have chronic back pain, and I have received services from the VA at Middleton Hospital for physical therapy, and I'm a member. I do Gerofit, and I am also have some medications, but I still have continued back pains, and then the problem is maybe some more medicine ends up having other side effects that are like too tired or well, anyway, can you give me some guidelines for chronic conditions, and after you've sort of come to the end of your services, how to get continued services to through my primary care doctor?
Hi, Richard. This is Erin Mullen from Primary Care. I'm thrilled to hear you're doing both PT and Gerofit, phenomenal services that we offer here. If you're still having pain, I think it would probably be really prudent to go back to your primary care provider and see if you need some updated imaging. We do have a pain clinic here that's an interdisciplinary clinic where we have a lot of staff that would be able to assess you and provide additional options and recommendations for treatment. So I'd get back with your primary care provider and talk about next steps.
Next step, okay. I appreciate your help. Thank you for your service and for providing this open mic or event. Thank you.
Thank you, sir. Appreciate that. Our next caller is Gordon in Watertown. Gordon, go ahead.
Good afternoon. No complaints, just compliments. I've only been in the VA system now probably for about 4 or 5 years. I'm 61 years old. Nobody explained it to me when I got out of the military about the benefits or whatever, that I was applying for, but I was treated by several private insurance doctors for hearing issues, and for several years, actually, a lot of my problems have been treated, and I feel like a lab rat. So I would just quit the treatments because nothing was working, and I was constantly, paying out this money for nothing, for them just to try different things. So I came to the Madison. I chose Madison as my location. And I saw a nurse practitioner, Bridget McDonald. I just want to compliment her because after probably less than a year, she figured it out and got my ears taken care of, and I haven't had an issue since now, probably for 2 years. And I don't know of any way to compliment these doctors and nurses that do a great job. 100% satisfied with Madison. I'm 100% satisfied with Janesville, the care I get from the VA. I think you guys all do a wonderful job. And I think my issues now are basically with my disability claims always being denied because my records were burnt. But I'm fighting it, and I'm going to continue to fight and make them give me what's due to me. But like I said, this was just a compliment, and I highly get the high praise for all you guys there in Madison. I love you all to death.
Thank you, sir. We appreciate that. We love you. We love all of our vets. I always say on these calls, our trust score rate is right around 24%. Somewhere between 94, 95-ish% of our veterans trust us with their health care. And obviously, we're not at 100%, but we certainly strive to make it 100%. So thank you for your positive comments, and they are definitely heard. Our next question, we've had a lot of Ricks and Richards. This is Richard and Baraboo. Richard, go ahead with your question.
Yes, I have a question about the Baraboo VA, the new facility. I think when it was built, they talked about having foot care, like to get podiatry care, get your toenails clipped there. I wondered if that's still in the process of getting done, or do they have it available now?
Hi, Richard. You're also hearing a lot from me, Erin Mullen again, in primary care. Yes, we had planned to offer those services, and we are still working on that with getting some staffing and rooms all freed up and appropriate equipment. So we are working on that. I wish I had a timeline for you on that, but I don't at this time.
All right, thank you much, and thank you for all the care that you guys do, just like the other veteran there that was stated that.
Thank you. Appreciate that. Next caller, we've got time for one or two more. We're going to go to Dale and Anilac. Dale, go ahead with your question.
Hello. Yes, I'm in Fond du Lac.
I hadn't heard of that city. It was typed in incorrectly. Sorry about that.
All right. I receive immune therapy injections for service-related conditions at an outside service, obviously. How do I go about getting those specific allergen serums and the monthly injections that I receive covered by the VA?
Hi, Dale. It's Erin Mullen again. I would get a message out to your primary care team, either through My Healthy Vet or calling into that clinic, and they're going to need all of those records to review, and then they can enter the consults that are needed to get those services set up for you.
Record. Yep, the records are a problem. Okay, I do have a letter from the physician there. All right, I'll reach out to my primary care provider in Beaver Dam then. All right, thank you.
Thanks, Dale. Next question, Chris in Partyville. Chris, you have a question about our eye clinic.
Yeah, good afternoon. Compliment. I have no problems with the health care that I've been getting through the VA. Been in the system for several years now. Baraboo Clinic, we got kind of a rotation through there. I don't know, I've had like the fourth or fifth primary care in the last few years here. But anyway, my question actually concerns the eye clinic. A couple of different times I would have tried to make an appointment to get in there, and be perfectly honest with you, I'm not sure if I want to or not. That clinic is understaffed or overbooked or something. That hallway out there looks like a cattle yard sometimes with all the people that are lined up. Has there been any thought into speeding up that process?
Hey, this is Dr. Marsh. Thanks for your call. And yeah, that's actually outside of our offices, so I see exactly what you're talking about. Lots of people there. We would love for that to be in a new spot to help with that flow, and that is always something that we're looking at our space. And then as far as wait times, we certainly are always looking at that as well, and what providers we can have at our facility. we always offer community care if we aren't meeting certain benchmarks as well. So that's always an option as well. But we are definitely looking at that as well as other types of services that we want to offer to our veterans here.
Okay, thank you very much for that. Appreciate it.
Thank you, Chris. And on that similar topic, we have another question, but we're running out of time regarding eyeglasses from the VA. We have a caller, Keith, who is asking, I have 2 prescriptions, 2 glasses. Can I get a second pair of each of those glasses?
Hi, Keith. This is Erin Mullen. Unfortunately, we can only provide 1 pair of each of your glass prescriptions, so you could get both, 1 pair of both of those prescriptions, but we can't give you a duplicate pair.
Excellent. Thank you. That's all the time we have for your questions this afternoon. If we didn't get to your question or you have follow-up questions, please stay on the line because in just a moment, you'll have the chance to leave us a voicemail with your questions, comments, or feedback. It may take us a week or 2 to get back to you, depending on your question, but feel free to leave us a message and we will get back to you. We very much thank you for joining us, and most importantly, thank you for your service, and have a great day.